What are parathyroid glands and what do they do for you? Hi, I'm Dr. Naznin Jamal. I'm board certified in internal medicine, and my goal is to empower you on just basic medical concepts and to understand diseases. So let's talk about parathyroid hormones and calcium. Parathyroid glands are small pieces of tissue that are located at the base of your neck, right on the thyroid gland. And they release a hormone called parathyroid hormone. This hormone helps maintain the balance of your skeleton. In addition to vitamin D and calcium, it also works with the ingredients of phosphorus and magnesium. Now, the parathyroid glands receive a signal from the brain to release the parathyroid hormone. This particular hormone actually acts on multiple organs and signals them to maintain the balance of your skeleton. Parathyroid hormone will act on your kidneys and stimulate the kidneys to create an active version of vitamin D. It will also stimulate the kidneys to reabsorb calcium and eliminate phosphorus. Now that vitamin D that was just produced by the kidneys works on your gut to help stimulate it to reabsorb all the calcium from your food. Now what's really remarkable about calcium is that the levels of calcium in the blood will also help trigger the parathyroid hormone and how much and how often it's released. The parathyroid hormone also stimulates the skeleton to release calcium when needed. How do you know if you have a problem? During an annual exam, a part of the basic blood work includes calcium. And if your calcium is too high or too low, your physician is going to ask you additional questions. Some of the symptoms that people will complain of having too much calcium can include aches, vague aches, abdominal pains, fatigue, lethargy, going to the bathroom to urinate quite a bit, and others. Having too little calcium can cause a tingling sensation in the fingers, a cramping in the toes and feet as well. Now, there are multiple medications to help raise or lower the calcium levels, but what's really important is to try to figure out the cause of the high or low calcium to begin with. And often, the parathyroid hormone will be checked to figure that out. Certain medications can also stimulate the levels of calcium in your bloodstream. Tums, also known as calcium carbonate, is a common antacid, and eating too much of that can cause high calcium levels and have further effects on your body's metabolism. Your body relies on you ingesting and eating enough calcium from your diet. When you're not having enough calcium in your diet, your body's going to get it from your skeleton. It will leach the calcium, and the exchange between the bones and the blood can be as much as 0.5 gram exchange per day. Now that doesn't seem like a lot in a short period of time, but when happening over a long period of time in sufficient quantities can lead to some major diseases. There are all sorts of reasons for loss of bone mass as we get older. Part of it can be influenced by other hormones. I hope that this overview helps simplify your understanding of what parathyroid glands are and what they do for your body. Until next time.